Good evening. We're being told to brace ourselves tonight with the warning that the worst weeks of the pandemic are still to come. Hospital admissions are still on the up, so too the case rate. But with 3 mass vaccination centres now open across London and the home counties, including at the ExCeL Centre, the elderly and healthcare workers have been queuing at the sites today to get their jabs. We'll have more on that in just a moment. But first, our political correspondent Simon Harris on the day the Nightingale opened again.
London's struggling hospitals got a much-needed boost today. The Nightingale is back in business to help ease pressure. The ventilators have gone. It's no longer a COVID-intensive care unit, but a large community hospital, freeing up beds across the capital.
We'll be taking patients who are over 18 and who may be recovering from an operation. They may be recovering from COVID as well, but they will come here negative. They will be COVID negative patients that need some help to get them back home.
ExCeL has plenty of space for the Nightingale to expand.
We have 2 32-bedded wards at the moment, so the plan is to open 64 initially, and then we can go bigger after that. We're planning to do that. You'll be aware that there's building work taking place around us, so we can go much bigger if we need to.
That could be as many as 300 beds. The repurposed Nightingale is at one end of the huge ExCeL site. At the other end is London's new mass vaccination centre. Both opened their doors today. The first to get their jabs waited in a socially distanced queue for an hour. But this was day one, and things should speed up as the vaccinators and volunteers get into their stride. Health bosses have set them an ambitious target.
At its peak, we're hoping to be able to vaccinate up to 10,000 people, if not a little bit more every day, when we're actually at our peak working.
There are now 1,044 patients on ventilators in London hospitals. That's an increase of 46% on a week ago. Worryingly, the number of new COVID cases in London has risen to 1,052 for every 100,000 people. Mohammed is a GP in Forest Gate in Newham, one of the East London boroughs worst affected by COVID.
The number of cases that we're seeing in primary care in the community have ramped up significantly over the recent weeks. The mortality is also ramped up. I don't know anybody who coronavirus hasn't affected.
There are now fresh questions about how effective the lockdown is. Ministers are said to be weighing up tighter restrictions.
The lockdown, first of all, needs to be enforced and followed.
Look around. Does it look like it's working?
You can tell by this high street. Is everybody out for essential stuff? Very much doubt it.
In Surrey, the former military rehabilitation centre at Headley Court has become the site of a temporary mortuary. Another sign that COVID is tightening its grip.
Let's talk about those restrictions, Simon, because earlier in the last hour, the Health Secretary said there were concerns not everybody is sticking to the rules. So are we likely to see those restrictions tightened?
Charlie, the usual rule of thumb is that it takes 2 weeks for the impact of restrictions to show up in the death rate or the infection rate. And we're only 1 week into this lockdown. But there's clearly a lot of concern in government about whether it's working. It's been reported that the Prime Minister, exercising in a park in London at the weekend, was alarmed at how many people there were. And as you said, Matt Hancock has just been speaking in Downing Street, where he confirmed that, yes, the restrictions are under review, but he ruled out changing specifically any of the childcare or support bubble restrictions.
OK, Simon, thanks very much. Well, with everything that's happened in the past few months, you may have forgotten that we were meant to have a mayoral election last year, which was postponed due to COVID. It's now meant to happen this May, but with door-to-door campaigning impossible, is there a chance it'll have to be postponed again? And what do the candidates make of that? Our political correspondent Simon Harris reports.
They're the 3 main challengers limbering up to take on Sadiq Khan. But Sean Bailey, Louisa Porritt and Sian Berry are all too aware election day could again fall victim to coronavirus. The battle for City Hall is due to be decided on May the 6th. Ministers are said to be keeping the date under review, although the current occupant of the 8th floor wants to get on with it.
My complete focus is on this pandemic and on making sure we get a grip with this pandemic and making sure that the NHS isn't overwhelmed. But I think the election should take place in May. We've seen across the globe elections taking place during this pandemic. It must be done safely.
I think democracy will call for an election, but of course it's about safety, isn't it? And the one thing that trumps our very storied history of democracy is keeping people safe.
Should the election go ahead on May the 6th?
I would like to see the election delayed now until the summer. We need a decision made soon so that councils can make those decisions about where to put their staff. Staff who are good at running elections are also good at running things like vaccination and testing.
It will be for the government to make that call, and we'll have to see what the experts think about how the virus is spreading in our capital.
Louisa Porritt is the newcomer in this contest. The former MEP stepped in when the previous Lib Dem candidate threw in the towel. Sian Berry is a member of the London Assembly and joint leader of the Greens. Sean Bailey is also on the Assembly and was once an advisor to David Cameron. Sadiq Khan was elected mayor in 2016. His 4-year term was extended when the election was postponed. The most recent opinion poll suggested Sadiq Khan was so far ahead of Sean Bailey, the election was almost a foregone conclusion. The survey, carried out by YouGov in November, put the Tory candidate 21 points behind the Labour mayor. Realistically, this is a two-horse race between Sadiq Khan and Sean Bailey, isn't it?
Well, it's not. If you look at the polls, Sean Bailey is miles behind Sadiq Khan, so there's room there for an alternative challenger, and I believe I'm that person.
I was the highest number of second preferences in the last election. If enough people just flip that around and put me first, I could be the next mayor.
The election in May is going to be a two-horse race between me and the Tory candidate, and Londoners can judge for themselves who is best equipped to take us through the next 4 years.
It'd be easy for me to sit here and say he's been a terrible mayor, but I'd ask a question to you. Do you feel safer now than you do 4 years ago? Are you paying any less to exist in London than you were 4 years ago? The answer to those two questions is no.
If the election goes ahead in May, whoever wins will be mayor of a city very different from the London of a year ago. Simon Harris, ITV News, City Hall.
Good evening. More than 10,000 people in London have died with coronavirus as the warnings continue about just how serious the situation still is in the capital. Tonight, already overstretched doctors and nurses are treating more than 7,000 of the sickest patients. More than 1,000 of them are on ventilators. At the Royal Free in Hampstead, the number of intensive care units has tripled to cope with demand. Our political correspondent, Simon Harris, reports.
This is critical care on a scale seldom seen in peacetime. The Royal Free in Hampstead is just one of London's hospitals on the COVID front line. It used to have 35 intensive care beds. Today there are 90 and all of them are full. 89 of the 90 patients have coronavirus and all but 5 of them are on ventilators.
Slightly overwhelming. It's there's just so many people to be seen, and as soon as one person leaves there seems to just be someone comes straight back in. Staff-wise, we're stretched. We're working probably the hardest we're ever going to work in our careers, but just got to get on with it.
Finding enough staff has turned out to be one of the biggest challenges. Even the simple task of sliding a patient from one bed to another needs 4 people.
There are no more intensive care nurses to be found. We don't have a secret supply of them. We simply have to use the nurses we've got. All of the intensive care nurses really stood up to this incredibly well. They're under immense pressure. They really are the front line of this, but they're working incredibly hard.
The hospital has drafted in medical students and care workers who have no experience of this environment.
Everybody here is really brilliant. Like, they know it's not my normal environment, so you know, nobody is putting me in a position where I don't know what I'm doing or anything like that, and they're giving me lots and lots of support.
For everyone involved in this crisis, it's a learning curve.
If you're an accountant or a human resources professional or an administrator, having to work in a ward is, it can be hugely motivating, but having to do it at speed and learn new skills really quickly can be really tough.
This was just a tiny part of one day in one intensive care unit in one London hospital. It's a scene repeated across the capital. Where it matters, where lives can be saved, the NHS is doing all it can, but it's under extreme pressure. Simon Harris, ITV News.
We heard from him at the top of the programme. Simon is back here now. So, Simon, the Mayor wants tougher restrictions, but are there signs that the current measures are doing something, are working?
Well, let's be honest, there are some very depressing statistics around. The number of Londoners dying with COVID has accelerated since the start of the year. On average, it's above 100 every day. And of course, more than 10,000 Londoners have now died since the start of the pandemic. But there are some glimmers of hope. The number of patients being admitted into London hospitals has dropped slightly. And in 14 of the 32 London boroughs, the number of people testing positive for COVID has also fallen. The Mayor described it to me today as plateauing. It's not yet a consistent trend, but it's encouraging. It's in the right direction.
Yeah, encouraging, that is the right word. Simon, thank you.